Hello, I'm Dr. Xenakis. If you have hand or finger pain, numbness, or tingling, and you don't think it's carpal tunnel syndrome, it might be another condition. And doctors often see 3 other conditions in their office, and I'll show you how to test for each one of those 3 conditions. The first is tendinitis, and in tendinitis, you have an inflammation of the tendons that run up into the hand and fingers. Now you can have flexor tendinitis on this side of the hand, or extensor tendinitis on this side of the hand. And the way you test for tendinitis is by doing what's called a percussion test. You tap the tendons really hard, up and down, about halfway down your arm, and tap left and right, up and down, really hard. Tap, 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 tap. And if you reproduce the symptoms in your hand and fingers, if they're worse, the numbness or tingling gets worse, or the pain is more intense, that's positive for flexor tendinitis. Of course, if you tap on this side and you reproduce the symptoms on this side, that would be positive for extensor tendinitis. Another test doctors do in their office is for Dupuytren's Contracture. And Dupuytren's Contracture is a dysfunction of the tendons that run up from the hand into the fingers. And oftentimes with Dupuytren's Contracture, you'll feel little bumps or nodes along the tendons. Sometimes a little small nodes, but oftentimes they're pretty big, and you can feel them and even see them. And another test for this is to try to put your hand flat on a table. I don't have a table here, but if you try to put your hand flat, it will hurt for the palm to touch the table. It'll hurt a lot, actually. So you'll tend to keep your hand tented up like this because it hurts too much to put it down. Again, that's positive for Dupuytren's Contracture. Another test doctors do in their office is for Quervain's Tenosynovitis. And Quervain's Tenosynovitis is an inflammation of the tendons that run up into the thumb. And to test for this, you do what's called the Finkelstein test. You put your thumb in your hand like this and make a loose fist, and then bend the fist towards your little finger. And if you have Quervain's Tenosynovitis, it's going to cause a lot of pain radiating out from the base of the thumb area here. That's a positive sign. But if you have none of those conditions, then you might actually have carpal tunnel syndrome. And I have another video that shows you how you can do tests for carpal tunnel syndrome. Thank you for watching.